oh, my dog's not in pain because he's not crying out, or my cat's not in pain. I want to dispel a couple of myths.
Welcome to Unleash Curiosity by Vital Pet Life.
I'm Dr. Amber Silva, veterinarian and advocate for integrative pet care.
And I'm Donie Yamamoto, founder and CEO of Vital Pet Life. We're so glad you're here.
This is a space where curiosity, compassion, and science converge, where we explore the powerful mind-body connection that supports your pet's health and your own.
Each week, we'll dive deep into the world of pet wellness, breaking down myths, exploring ingredients, and learning from expert voices across the industry.
From nutrition and sustainability to transparency and advocacy, we're here to help you feel more confident, connected, and informed in your care choices.
Let's get into it, because when we know better, we do better. This is Unleash Curiosity. Today, we're talking about something almost every pet owner experiences at some point: watching their dog or cat starts slowing down.
And the challenge is that many people assume it's just normal aging, when in reality, stiffness, hesitation, or reduced activity can be signs of chronic inflammation and joint degeneration already underway.
Dr. Amber, can you tell us, because I know how pets really instinctively hide pain. What are the subtle signs that owners like me overlook? I mean, I look at everything, but I mean, for all our pet owners that are listening out there, like
Yeah.
mobility and for their aging dogs.
Yeah, I mean, it is true that our pets want to hide pain, and they're not just trying to be stoic like a human. It's a survival instinct for them. So, I want to dispel a couple of myths like, oh, my dog's not in pain because he's not crying out, or my cat's not in pain because she's still eating, or, something like this. So, or he's not limping. Those are pretty overt signs for sure. And some animals will cry out and will limp and all of that. But there are a lot of more subtle signs that we may miss. And so, things to look for. Are they slower to stand up? We see dogs and cats that have been like sleeping overnight, and they wake up in the morning, and instead of just jumping up and going about their day, it takes a while for them to stand up. They seem really stiff, and it takes a minute or two or longer for them to kind of get going and work their joints out. Another thing would be avoiding stairs. I see this actually a lot in older cats.
Really?
Cats, I've seen a lot of older cats who get arthritis in their lower back. And so they're more hesitant to go up and down the stairs. And I think that in my experience, cats, even more than dogs, hide their pain. So some owners may not even notice this, but I do see a lot of cats that are hesitant to go up and down stairs. Maybe they're not jumping up or down from their cat tree anymore. Dogs may hesitate to jump up in the car. So any of those subtle things, like also with cats, because especially indoor only cats that are using a litter box. And if they're, let's say they're mostly in the main living area, but their litter box is downstairs in a bathroom, let's say. And then we start seeing them go to the bathroom outside the litter box. We may think maybe my cat has a UTI, like we want to rule out those other causes, but maybe it's a mobility issue. Maybe they're just too painful. Like it hurts too much to get to their litter box. If it's, going up or downstairs, or it's a longer distance away, they might just be like, ugh, I'm just going to go where I can because it hurts too much to make it all the way to my litter box. And so we want to, especially we want to look for that in cats too, as, inappropriate urination and defecation as possibly a mobility issue.
Yeah.
And we're going to, let me just say as a vet, like we want to run tests to make sure that we're not missing any other medical things.
Mm-hmm.
Like bladder stones, like UTIs, like any,
Mm-hmm.
GI disease, but we need to rule out mobility as a problem as well.
Yeah, there's a lot of connection between movement and long-term health.
Yeah.
Yeah, but can you like explain those connections to our listeners?
Sure. Yeah. There's a couple of other subtle signs that we might see, like sleeping more or being less interested in playing. It's too painful to play as much as they used to. There are a lot of connections between movement and long-term health that we may not think about. Our number one thing we think about is arthritis, and that's painful joints. That's inflammation in the joints that cause pain. But the body is a whole entire system. So that means muscle maintenance. So, and weight control. So, dogs and cats that are painful in their joints, they're probably going to have some muscle atrophy. Their muscles aren't going to be as strong as they used to be because they're not moving as much. So they're gaining weight. The metabolism might go down. They're not able to move and play and get that mental stimulation. Or sometimes it can even lead to behavioral issues, like dogs that have been well trained in the past, maybe they're not sitting on command anymore. They're not, following some of those commands. Not necessarily because they're just naughty or they've forgotten. Maybe it's painful for them to do those things. So those are some of the things we want to think about as well when it comes to mobility and long-term health.
Exactly. And us too, like pet parents, it's a little like stressful. Like as you mentioned, personality changes. It happens slow. You don't really know which area or why is he in pain. It's just something different. Like you feel helpless when you do that, when
Yeah.
you don't happen. Yeah.
Yeah, and especially because it is like it can be this vicious cycle. Like poor mobility leads to muscle loss and weight gain, leads to less movement, leads to even more joint pain. It's more inflammation. Like it can be this really vicious cycle that it's obviously difficult and painful for the pet, but as an owner to see your pet go through that can be really hard and it's sad, emotional, and it's frustrating, and all of these things all together.
It's like vicious
And
cycle.
exactly, yeah.
When does slowing down stop being normal aging and start becoming something we should actively address? So, Dr. Amber, we discussed about joint degeneration. Can you break it down? Like, what is it? Can we discuss also like for large breeds? And then, I mean, I'm pretty much like aware of the IVDD for, the short-legged dogs and senior pets too, losing mobility
Yeah.
faster. Yeah.
Yeah. So I think most people are familiar with the term arthritis. So arthritis is inflammation in the joints. But let's dig a little bit deeper. What does that actually mean? What do we see inside those joints? So, the inflammation, they get red blood cells, white blood cells, inflammatory products in those joints. It wears down on the cartilage. So it's not just a bone issue, it's cartilage on top of the bones. In those joints we have cartilage that cushions the ends of the bones. But with inflammation, you can get tears and swelling and just damage to that cartilage, which is painful. It also affects the joint fluid. If you actually look at joint fluid side by side, like normal joint fluid, if you put a drop between your fingers, it's kind of sticky and you'll see a string between there. But when you have inflammation, it's actually more watery, so it won't form that string between your fingers.
Really?
So instead of being kind of like a thicker, viscous fluid that's cushioning those joints, it's thin and watery and filled with all kinds of inflammatory debris. So,
Have you seen
it's,
that practice? I mean, I assume when you are operating it, I guess, like you don't really see it like on reg.
yeah, I probably haven't seen it since vet school. You'd probably see that more in like an orthopedic specialist practice. But I think it's a good visual because we think about joint inflammation, but it encompasses more than just the pain that we see. There's cartilage damage, there's bone inflammation, there's joint fluid inflammation, there's
You touch
stretching of the
them.
joint capsule.
I massage the guys sometimes. I'm in tuxedo, especially at night. I like if you hear like a clunk, like like a crack. Is that bad?
Yeah. I mean, pets' joints will pop and crack just like ours will, and it doesn't necessarily mean anything bad. So that's different than just I stretch out a dog's hip and it kind of it pops. It's more of like a crunching, grinding. Could mean a few things. It could mean that there's some bone spurs
Hmm.
that can happen with chronic inflammation, arthritis. You can get some extra bone growth, and so you'll feel that when you're moving the joint around. It could mean that there's some loss of cartilage. And so instead of that nice cartilage pad, you get more of like a bone on bone grinding. So, yeah, there's a difference between just like a normal pop when you're moving the joints around versus crepitus, that grinding.
Thanks for that, Dr. Amber. I think by the time that the limping is obvious, you can really tell already that the degeneration has already been happening for a while. I always
Yeah.
like look at the way they walk. Yeah, I mean, Dr. Amber, like navigating joint products is a little bit overwhelming. Like,
Yeah.
explain to me the stuff that is really needed. Like, I know there's like some pain medication that my vet, like, what's this recommends when he's really in pain. And then, I always consider like kidneys, liver issue, GI health, and why it's better to have like a supplement product or like supplementing them than waiting for the pain meds.
Yeah. Yeah. And I think I am definitely a proponent of starting joint supplements before it gets so bad. Even in high risk breeds, start them when they're still healthy, before there's inflammation in the joints. But there are pain medications that we can use. NSAIDs, that's a major class of pain medication that we use specifically for joint pain. It's an anti inflammatory. So we're treating the inflammation and relieving pain, but we can have some long term side effects in liver and kidney. Sometimes it causes, vomiting or diarrhea.
Yeah.
And honestly, I will say there are some patients, their pain is so bad that they have to have this every day just to have a good quality of life. So I'm not saying, oh, you shouldn't ever do it. But we need
Yeah.
to know the risks, and I typically recommend blood work for sure, blood work before starting it to make sure that those organs are healthy prior to starting. And then, especially when a dog is on it on a regular basis, a dog or a cat are on NSAIDs, then we're going to do regular blood work. And that may mean every 6 months, every year, but we want to make sure that we're not harming the pet more than we're helping them. We want to make sure that their organs are still healthy and that they can continue to get that pain relief, because sometimes there's just no other way to treat them and keep them comfortable. So let's talk about supplements. So sometimes I've had plenty of owners who came in and said, well, I think my dog has arthritis. I started him on this joint supplement I got at this store, and I haven't seen any difference. Well, it might be that the quality of the product is just not that good. I mean, there's a ton of products on the market, and just reading the label claims or reading the ingredients, it can be really difficult to know what the quality of this product actually is. Like, a lot of the stuff on a label is just a marketing tool.
Yeah.
If we're giving a poor quality product and we haven't seen a difference, then I will always recommend a product I trust, that I know is third party tested. They're high quality. They've gone through testing, scientific research. So, uh, again, if you have your dog or cat on a joint supplement and you haven't noticed a difference, it may just be the quality of the product you're giving. So, and the other things, not just quality, but it has to be absorbable. So some things that we give can be ingested and it just goes straight through and gets flushed out of the body. So obviously, like, it's not going to help if it's not being absorbed into the body and incorporated. And so that quality of the ingredient and the bioavailability, that's the fancy term we use. Is it absorbable and available to our bodies, to the dogs or cats' bodies? And so that's a really important factor as well. So it's pretty exciting because there are some, newer type of joint products. And I'm not just talking about like a certain brand. I'm talking about certain types of supplements that are fairly new, but backed up by some good data. So, we all know about omega 3s. We talk about it all the time. So omega 3s that are available to the body, there's collagen. Green lip mussel is a great organism that gives us a lot of good joint support. So that's really exciting to me. And we're starting to see some research come out, and some of this stuff is like helping to support the joint fluid. So exciting time in the, pet supplement space, especially to see some of these products that have these ingredients in them that are shown to be very helpful for joint support. And then I think we're becoming more aware that, earlier support is better. We
Yeah.
don't want to wait until, until the arthritis is so bad that we started a joint supplement then. Let me just say, if you haven't started a joint supplement and your dog gets diagnosed with arthritis, we're going to start a joint supplement. I,
Yeah.
I don't feel like any patient is ever, how do I say this? Like in those really bad cases that we're first diagnosing, I'm still going to recommend a joint supplement. I'm still going to recommend omega 3s because I think they can help. But we have better success at treating and slowing down the progression of that inflammation and that arthritis if we started earlier.
Yeah. And also, like, there's a shift now, like, as I said a while ago, or the previous, like, episode we're in, there's a lot of, like, study and education for us consumers or pet owners. And we're demanding for cleaner ingredients, and companies are really putting it out there. There's also clinical studies that are available, and it's better to be proactive too than a reactive care, because we wanted
Yeah.
our pet to stay longer, be active longer, not just to, not just to
Yeah.
live. Yeah.
Right. So I guess the key takeaway is that the future of pet longevity isn't only lifespan, it's also preserving quality of life. So we want to, increase the quantity of life, but preserve the quality of life.
Yeah. And then, mobility changes should never be ignored. Earlier support can create like better long term outcomes.
Yeah. Joint deterioration is progressive. And so if we can do, daily things, daily interventions will compound over time. So, the joint supplements, the short walks, the massages, the good nutrition, all of these little steps that we can take on a daily basis will help improve that quality and quantity of life over time.
Okay. Well, a longer life means very little without comfort, movement, and the ability to enjoy it. Protecting mobility may be one of the most important things you can do for our pets' long term health. Thank you for spending this time with us. If this episode resonated, share it with a fellow pet parent who wants more healthy years with their pet. Join us for more science backed ways to help your pets thrive through our Spotify, Apple Podcasts, and YouTube channel.
And if you have a question or want us to cover a specific longevity topic, send those questions in at podcast@vitalpetlife.com. We love hearing from you. This is Unleashed Curiosity by Vital Pet Life. Until next time, stay curious.